Linezolid-induced lactic acidosis, which eventually explained our patient's elevated lactic acid. So how does linezolid cause lactic acidosis? Let's discuss the pathophysiology. Linezolid is a strong antibiotic that fights resistant infection, which our patient was on for a recent infection. And it works by binding to bacterial ribosomes, inhibiting protein synthesis. But check this out. Our own mitochondrial ribosomes resemble bacterial ribosomes, so the antibiotic binds to mitochondrial ribosomes, inhibiting protein synthesis and eventually shutting down aerobic respiration, which makes the cell switch to anaerobic glycolysis, thus producing lactic acid to try to salvage some energy. This is a pattern consistent with cytopathic hypoxia rather than hypoxic lactic acidosis. This form of lactic acidosis usually occurs when linezolid is taken for a prolonged period of time, usually more than 2 weeks. And the FDA has issued a warning for this exact mechanism. The good news is that most patients recover when the antibiotics is discontinued within the first 72 hours of admission. In some rare cases, patients have to undergo dialysis to help with recovery. And in this case, the patient was able to recover in the ICU and was later discharged from the hospital in great condition. So the moral of the story is, if you can't really explain a lactic acidosis in your very sick patient, take a step back and listen to the patient, look at the medication list, and try to find out the exact reason that is causing this lactic acidosis instead of trying to mask the problem with more fluid. I hope that was helpful.